You're watching In Your Interest here on News 9 Live. I am Krishna Kumar. Is air pollution cutting down the lives of Indians? That's the big story that we're taking up at this point. India's air pollution crisis is taking a major toll on the health of its citizens. A new report from the University of Chicago's Air Quality Life Index reveals that persistent air pollution could reduce life expectancy in India by over 3 years. Despite an over 19% drop in particulate matter levels in the year 2022 compared to the previous year, the average Indian resident could still lose 3.4 years of his life or her life if current pollution levels persist. The report also highlights that while Bangladesh is the most polluted country overall, India bears the highest health burden due to its vast population. The northern plains, home to more than half a billion people, remain the most polluted region. Here, even though particulate matter levels dropped by 17.2% in 2022, residents could end up losing an average of 5.4 years of life expectancy if the pollution persists. Even with the potential for a 1.2-year increase in life expectancy if current improvements continue. The situation underscores the need for more mitigation efforts going forward. And to talk about more, we have Dr. Rajesh Chawla, pulmonologist and senior consultant at Apollo Hospitals, now joining us live on the broadcast. Dr. Rajesh Chawla, thank you so much for taking time out to be with us over here. My first question is, in terms of, there's nothing new. At this stage, we're just getting ready for another winter season. That's when, specifically in Delhi, the national capital in North India, per se, the pollution levels go through the roof. But what it does is that it makes us think in terms of the overall life expectancy. That's the kind of statistic that makes you rethink the way you think about this.
It's a common sense. The Delhi is the fourth most polluted city in the world, and we have PM 2.5, PM 10. We are hitting all the time along with the gases. And I mean, if you spend the time in the pollution of Delhi for one day, it is like smoking 20 cigarettes a day. So that is the level of pollutant which go inside the body. So they will definitely have a effect on the life expectancy. The study from Chicago group, they have found out that there is decrease, and they have found it's not really very easy to find out how much there is, but definitely it does decrease the expectancy. If you are staying in city of Delhi, then you are staying in a place like Mauritius or places where there is a very less pollution. Even in the good days, like now our good days, there's a lot of raining. Still, we are not that safe as in many of the other cities in the world. PM 2.5 and PM 10, they are still around 50 or below 100, but they are not really very safe even now. So a citizen of Delhi all the time is uh, taking these inhalants inside, and they are on a long-term basis, they are causing diseases like the chronic obstructive lung disease, recurrent coughs, sinusitis, cancers, and many other illnesses.
Right.
Back to
Uh,
you.
Right. Dr. Chawla, the question here is that the report also says that if India were to meet its national PM 2.5 standards, life expectancy for Delhi, the capital's residents, could increase by 8.5 years. There is a clear opportunity over here to fix things.
You know, it is easier said than done. If you know, there are a lot of projects which have been done, launched nationally and even in Delhi. There locally also they have launched a lot of, last time, November is the time when we have the maximum AQI index. I think it's a well-known fact to every Indian, where there is no air movement, there is a burning of the parali in Haryana and Punjab, there is no air movement, and it's the because the dust settles down, and in addition to the usual motor vehicle, diesel sets, thermal power plants, all these are there. The government of Delhi had launched last time. They said they closed the schools, the water sprinkling. They said the thermal power plants were closed. And like that, many steps were taken. But implementation was really not that good. And the AQI kept on remaining somewhere there. But I think it's the lot of cities in the world have done, Peking has done. So if it is has to be done, the nation, the national government, the the state government, both have to work together to find out the policy, to lay down the policies and their implementation. Then it is definitely possible. It could be at a motor vehicle level, like BS6 were banned in that period. So they need to lay down the policy and implementation. They have said that vehicles beyond 10 years will not operate, and people still keep on operating them. Few have caught, but then still they keep on operating. Similarly, the the less use of diesel, although the Delhi government is saying that they will not use diesel, but still I think it is being used. Similarly, for the DG sets, still you see around in Delhi many houses still have the diesel DG sets. So all these, if everything is implemented and law thought out plan, definitely there would be a change. As you said, if the air can, it is, you remember the time when the COVID was there, a lockdown, it was the cleanest city. So it is possible. It is not impossible.
It is possible. It is not impossible. Also, because the report clearly states that the particulate matter pollution of PM 2.5 is down in the year 2022 as compared to 2021, and down by nearly 20%. So there is light at the end of the tunnel, if I may.
Yeah, still it is not. The best is 0 to 50. We are nowhere near.
We have quite some work to do, and we have to think about it, especially at least ahead of this winter season that is coming up ahead of us in just a couple of months. We can at this stage only hope for the best. But Dr. Rajesh Chawla, thank you so much for being with us. Dr. Rajesh Chawla, pulmonologist and senior consultant at Apollo Hospitals. And with that, we've completely run out of time here on this edition of In Your Interest. Thank you so much for watching. This is Krishna Kumar signing off.